Capgr Delusion. Individuals with Capgr delusion hold a belief that someone close to them has been replaced by an imposter, an exact physical double, leading to significant distress and confusion. The condition often occurs in conjunction with other mental health disorders, such as schizophrenia, dementia, or after a brain injury. Affected persons might confront their loved ones, demanding proof of identity, or may even become hostile towards the imposter. Cotard's syndrome, also known as walking corpse syndrome, Cotard's syndrome is characterized by the belief that one is dead, does not exist, is putrefying, or has lost their blood or internal organs. Severe depression and hallucinations may accompany these beliefs, and the person may neglect their hygiene and health, reflecting their feelings of non-existence. It's most commonly seen in individuals with major depressive disorder or psychosis. Alien hand syndrome. This disorder causes an individual's hand to act on its own, performing complex actions without the person's intent. The affected person may feel estranged from the limb, as if it were controlled by an external force. This syndrome often results from brain surgery, stroke, infection, or tumors, affecting the brain regions responsible for motor control, particularly the corpus callosum and the frontal lobe. Froli Delusion. In this rare disorder, an individual believes that different people are actually a single person who disguises themselves or changes appearance. This delusion can lead to significant paranoia and distress, as the person believes they are being pursued by this shape-shifting entity. It often occurs alongside schizophrenia, brain injury, or dementia, necessitating a comprehensive approach for management and treatment. Diogen Syndrome. Characterized by extreme self-neglect, hoarding behavior, social withdrawal, and a lack of shame, Diogen Syndrome typically affects the elderly. Individuals with this syndrome live in severe squalor, accumulating large quantities of often useless items, and show an indifference to their living conditions. The causes are not well understood, but may include factors such as social isolation, mental illness, or dementia. Foreign accent syndrome. This rare neurological condition results in sufferers speaking their native language as if they had a foreign accent. This syndrome is usually the result of a stroke, traumatic brain injury, or other neurological conditions that affect the speech center of the brain. While the individual retains their language skills, changes in timing, tongue placement, and intonation can make them sound as though they have acquired a new accent, often leading to social embarrassment and frustration. Alice in Wonderland syndrome, AIWS. Individuals experiencing AIWS have perceptual distortions, seeing objects as smaller, micropsia, or larger, macropsia, than they are, or misperceiving the shape of objects. Time perception and body image may also be distorted, causing significant distress. This syndrome is often associated with migraine headaches, brain tumors, and the use of psychoactive drugs. It's named after Lewis Carroll's famous character, Alice, who experienced similar distortions. Exploding head syndrome. This condition is characterized by the perception of loud, non-existent noises, such as explosions, gunshots, or crashing cymbals, upon falling asleep or waking up. It's a type of parasomnia, an undesired event that accompanies sleep. Despite the alarming nature of the experience, it's generally considered harmless. The exact cause is unknown, but it may relate to minor seizures affecting the temporal lobe or dysfunction in the neural structures responsible for sound processing. Ebom syndrome, delusional parasitosis. People with Ebom syndrome are convinced that they are infested with parasites, insects, or bugs without any medical evidence. This delusion can lead to severe distress, social isolation, and self-harm as individuals attempt to remove the non-existent infestations. Treatment often involves antipsychotic medication, but convincing the patient to accept treatment can be challenging due to their firm belief in the infestation. Stockholm syndrome. This psychological response occurs when hostages or abuse victims form bonds with their captors or abusers, sometimes leading to positive feelings towards them, despite the danger or risk involved. This syndrome can complicate rescue efforts and legal proceedings, as the victim may express empathy or sympathy towards their captor. It is thought to be a survival strategy, where the victim sees bonding as a way to ensure safety during captivity.